All right, so why can coughing or sneezing give such intense pain, either from like in the lower back, right? We have like a sciatica issue. So a cough or a sneeze, boom, down the leg, or in the neck, it's going to cause like some kind of maybe shoulder blade or arm pain. Hey, I'm Chris, your herniated disc fix expert. Just want to talk about a couple of reasons why coughing, sneezing, that internal pressure will hurt so much. We actually use that as a test to determine if someone is having a disc issue. So because the discs are a dynamic and kind of a cushion type structure in the body, when part of that disc is bulged or herniated out, that internal pressure of coughing or sneezing will likely increase the pain. So it's nothing to necessarily be concerned about, but you definitely want to use it as a piece of information to identify that, hey, I probably have, likely have a disc issue going on with that, coughing or sneezing, increasing pain into the leg or into the arm. Now, what are we going to do about it? So once we've identified that, yeah, this is likely what's going on, right? And that's the most common reason anyway. The most common reason for, leg or sciatica type pain or like, pinched nerve or arm pain is the disc. It's the most number one cause by far. So initially we want to make sure that we, one, identify, that there is some kind of disc issue going on. But then what you want to do is we need to assess it correctly. So we have to make sure that we're moving in the right direction, testing end range movements in the lumbar spine to try to identify a directional preference. Most people do have a directional preference. We're moving into a certain direction, whether it's flexion or a side glide or extension, will reduce and move that pain like up and out of the leg or up and out of the arm. Obviously, it's going to be different cervical motions. But once we have identified that, we work into that. Once we have all of those symptoms reduced or abolished from the leg or the arm, then you want to change into more return to function exercise. Here's where most places or where you go to or clinicians make the mistake. Too early on, you're introduced to core or strengthening type exercises. You can't strengthen a bad disc. A disc is not a muscle. It's not a tendon. You can't strengthen it. It becomes counterproductive a lot of times to work on, strengthening type things, core stuff, holding this way when it's not a muscle problem. You first need to reduce that disc, move it back out of the way, reduce the symptom in the leg or the arm. Then you can start reintroducing some of the other movements, whether it's, maybe we're intolerant to sitting and bending, which a lot of people are with a low back or a disc injury in the back. They don't like to bend or sit too much. They'd rather be kind of up moving around. So once we get that reduced, then we can reintroduce some of those other motions and then start working into some, lower or basic level strengthening to help the healing process. But initially, you're moving into strengthening things right off the bat when you have full blown like pain down the leg or down the arm is usually not helpful at all.